Okay, well, I think we're gonna get rolling because we don't have quorum, but do you want to update the folks that are here about the report that's due in April? And
Yes,
then
so we
I'll give a
received-
little update on our activities.
Perfect. So yes, we received an email from the city manager's office from Angela Fuller, reminding us that as of March 27th, they need a report from us on an annual summary. I have been a member of the committee since the fall. I don't know if you met previous of that, but most of the summaries, all right, so most of the summaries or a report out of, and it depends on how often the committee's met. So for example, the example she gave for the commissions for persons with disability, just talked about how frequently they meet, the purpose of the committee and what they're hoping to do in the future. Because
Great.
it appears that committee had not met as frequently, kind of like ours, where we haven't had a full quorum in a couple of months now. It's our second month in a row. So ours may be more similar to that, where it's really an explanation of how often we meet, why we were commissioned in the first place, and our hopes for the rest of the work for this year.
I love it. That sounds great.
Because another committee that she sent us an example of, it appears as if they have met frequently. So they actually listed an executive summary, a narrative of all the meetings, rationale, and the parameters of their work.
Okay, I don't think we need to do any of that yet because we don't have any of that to report on. Plus, we don't have a budget for a recording secretary to be documenting such things. So I think that's great to just have a cursory. Do you want to like whip one up and send it out to the group in the
Yeah, I
next
could do
week or
that.
so and have everybody review it and agree?
Absolutely.
At least we
So
can get some level of engagement that way.
yeah, that would be perfect. So what I could do is draft up, similar to the Commission for Persons with Disability, a report of what ours is so far.
Great.
Kate, if you don't mind, I'll send it to you as just a draft for a quick look,
Sure.
and then I can send it out to the committee to get your guys' feedback on it. And I
Definitely.
probably will be able to have that to you before the end of the day tomorrow. I'm currently covering a school, so.
Oh yeah, I know you're in it. No, we understand. It doesn't have to be done right now. We've got like 2 weeks, so.
Okay. But yeah, we'll get it to you this week. I'll at least have it to Kate ASAP, and then we'll get it to you guys this week so that you can also review it. Sooner is better than later for me too.
Great. Yeah, I'm gone that whole week at a conference in Boston, so sooner is better, but I'll still be available via email if you need me. So any other agenda things? I mean, we can't really go through it because we don't have folks. You have attendance, right? For at least those credit due for those who showed up today.
Yes.
And you can see
I saw
Patrick,
Patrick, Sheila, and Melissa.
that's it. Yep.
Yes. I don't know if they want to, before the next meeting, look at the website that Mr. Zuzel sent, Health Equity Solutions, their vision, their mission, and their goals, so that you're just prepared for the next meeting.
That's great. I love it. Yeah, carry that over.
We could probably take recording secretary off the agenda since we know we don't have one.
I
Unless
think we
need to
should
say
keep
that to the
it.
whole group.
We
Okay.
should keep it on there until we tackle it, just so that it doesn't get lost. And when the budget season comes, there's an allocation carved out for that. A little placeholder, if you will.
Perfect. And then I can attach the report that's due March 27th to the April agenda, even though you will have seen it, just so you have it.
Perfect. And is that all the housekeeping stuff? Okay. So just a quick update on what Joe and I have been up to over the past couple weeks. An RFP went out through CDBG for COVID money, some recaptured COVID money. So Joe and I have been writing an application for that money to bring, we're not calling it a clinic, but senior healthcare to the existing center for that. So UCFS is in there with a podiatrist and RN 1 day a week, but that clinical space goes grossly underutilized. And so seniors are a target population for that CDBG CV45 pot of money. So we're hoping to bring a community health worker in to work with the seniors on site and this grant will also fund them traveling to senior housing complexes and meet seniors where they are, to help overcome some of the health disparities seniors have faced as a result of COVID.
Will that include mental health?
We already have mental health covered in the clinic through ARPO 6. And we just got 5 more applicants for that money, clinical applicants for that. So we, Aaron and I met earlier today to review them, and I think we're gonna get some more clinicians. So,
Okay, excellent.
yeah.
You still have a part-time social worker up there?
So we have social worker in our department is different than clinician, basically. So like a lot of us are social workers, but if they have the LCSW and can see clients and that mental health thing, like track, then that's under Aaron as clinical coordinator. And the person who replaced me, Sarah Warzika, she is a program coordinator and she's also a licensed clinician. So we have 1 clinician full-time on staff, and then we have a contract. We just put an RFP out and it closed on March 3rd to hire on clinicians.
So Monroe City still has a part-time social
So
worker.
that's through ARPO 6.
Okay.
And that's Carrie through, and so she sees seniors through ARPO 6 money. And so she'll carry on seeing seniors and youth. And then we'll have some more clinicians seeing youth
So one
right
of
at youth and family. So we're sharing it because we're all one department.
I went to Hamilton Park Apartments a couple weeks ago, and they had a EMS, I think it was American Ambulance, actually. No,
Okay.
fire department. Had actually done taken a person out of their apartment, brought them back. I guess they had bed bugs all over them.
Oh,
Really?
So I went and talked to the property manager and they said, oh, well, they're not due for their annual inspection yet. They are due shortly. And I said, well, are you aware of the complaint? And they said, well, we weren't aware that the person had been taken out of the apartment. We don't generally know when the fire department or ambulance comes here, which I thought was a little shocking. The property manager doesn't know that they've had EMS in their
incident?
building.
Yeah.
And then they said that it's going to be done. It's done every 12 months and this person's due, but their daughter had called last week. So we have pest control scheduled for like 2 weeks from now. And I'm thinking, first of all, pest control's coming in 2 weeks. You don't do annual like regular inspections other than 12 months. So they don't go in these apartments to see how bad it is. And you have clients that are getting removed and nobody in the building knows about it.
Well, so
So
this
that's why I'm thinking
plan
that,
would really
yeah.
help with that because we're gonna meet people where they're at. Our roaming community health worker will be able to bring that stuff to your attention.
Yeah.
And ours. So yeah, here's
I think
hoping
it
we'll
could go both ways.
Yeah.
That'd be nice for the fire.
reduce comorbidities across the board. I'm here for it. I love it. So that's our little exciting update. Hopefully that's why Joe's not here right now because he's finishing up that grant application.
and it's due
Uh,
when?
It's due Friday.
Friday. Okay.
Yeah, we're really close. So I'm excited and I think it will check off some of our boxes for health equity committee. So there's movement happening.
You got all 10 copies ready to go?
Oh, I'm ready. No, not yet. I have to get it signed first, but you know, and 3-hole punched. No, not just 10 copies. They have to be 3-hole punched too. I had to find a 3-hole
Yeah,
puncher. That was
Yes,
something.
yes. It's like, we're still doing that in this day and age.
Oh, a question.
My question is, who's talking?
That's me. I'm sorry. It's Kate
Okay.
Moody from Human Services. Nice to see you again.
Thanks, okay.
I'm trying to
I
make
didn't know who it was because we can only see the other end of the room.
That's fair. I'm the staff person here, so I'm not officially a part of the group, but
Gotcha.
I wanted to make sure the stars of the show were actually showcased, but here I am. That's me. Nice.
Thanks.
All right. Well, I guess we can call it. We were 15 minutes in and we had no other takers, so. Wait, hold on.
You have some people in the waiting room? Oh,
Oh, hold on. We've got some now. Let's see. Is that enough?
I know, I have,
So we got 1, 2, 3, 4, 5, 6, 7. Still not enough for a quorum. Mhm. Well, thanks for coming, you guys. We're sorry, but we don't have enough people for a quorum. So we're gonna make a collective group decision.
1, 2, 3, 4, 5, 6,
1,
7,
2.
8.
I don't count.
No, I don't have you on there. I,
Yeah, 2, 4, 6, 8.
1, 2, 3, 4.
There's 3 screens, right? Pat Daly's on
1,
Oh,
2,
your
3,
screen is over
4,
there.
5.
Okay.
Yeah,
So-
see,
Oh,
okay.
did that,
You guys
does
are
that
7.
take Erica out though? Because Erica cannot make the meetings.
and so I think that there was gonna be an ask to Erica, just from somebody was gonna ask her to see if there was another representative who could come. I don't remember.
Okay.
Do you remember who was tasked with that ask? Sarah?
I do not.
Mm-hmm.
So if we can tell somebody to get off, then we can.
Well, that's like.
No, if we can get one more person on here right now, we'll have a quorum.
We just vote them off.
Oh, if we vote them
can't
off,
vote them off
unless we have a quorum. Therein lies the conundrum. So they were talking about if we wanted to eliminate somebody from the list because of inaction, and at last week, or last meeting, the discussion was not to eliminate them, but see if they could find somebody else to come in their stead. And then if we were to try and just vote them out unilaterally, we would have to have a quorum in order to do that. So we're still stuck. But everybody's gonna agree to bring a buddy to the next meeting that's on the list. Okay, I'm bringing Sheila, done.
She'll bring me and I'm bringing you.
Oh, and Pat, I guess he's joined our alliance. So Patrick has joined our alliance, and but if everybody could make a good effort, we'll send out extra reminders. But I think having all these smart brains in the same room, really, there's so much potential. We just need to tap into it. We'll get there. It's a slow start. Everybody's busy, but keep showing up, okay?
And Sarah, I might, when you send out the reminder, like you did this past week, I might say put RSVP. Their attendance, that might help.
So for today, let's see if I could open the invite and see. We had myself, Alexander, D. Marks, DOH at Uncas Health,
That's
Joe,
Patrick, yep.
Salomon, Kate, Melissa.
Go get John.
Those are who responded yes.
No, he's staff too. He's not on the committee. Any of us that work here won't count. Bridget technically, maybe Bridget. I could maybe grab her.
See
She's
if the meeting-
downstairs. She's listed on the committee, but she's also staff.
If we don't actually have any work to be.
We don't have any work to be completed. That's a fair point Patrick brought up.
But this could be at least a legal meeting.
It could be.
If you bring her up.
Yeah, let me see it. I'm gonna just run downstairs and see if I can bring her up and this counts at least, okay? I'll be
because
right back.
I just don't think it looks good. This is the second, we people work showing up. I mean, I know last month I had a conflict with an appointment that took longer than. This is the time everybody said was good for them.
Probably on the next invite, have to tell people to please respond so we know if we have a quorum, as we haven't been able to yet, something like that.
Right, but this is the time, most people said that they were available. I mean, that's. Because they didn't want to meet after work, so,
And there's a virtual option.
and it's a virtual option, so that even,
Well, it looks like Bob Farwell is trying to get in too, so he might be
Oh,
another option when she returns.
it's not popping up here.
I'm asking him via chat if he could try again.
Okay.
And then we'll see if he pops in.
She said Bob Farwell was trying to get in. She's trying to see if he'll try back.
Okay.
Yeah, he
well, that's
just emailed
good.
us. Yeah, he emailed about 1 minute ago and said he's trying to get in. It worked from home yesterday, but it's not working from his office. He's gonna try to connect again. I
Okay,
told
so
him,
he's
"You
gonna
are
try to come
watching the
back on.
screen."
All right, we're waiting.
Yeah.
I can see if he's in the waiting room here. Oh. Mhm. Anybody do anything fun this weekend?
I just got back from DC last week, talking to our senators and congressmen.
That's exciting. Thank you.
Mm,
Topic?
advocating for money, singing for our supper, I call it.
Okay. As Bob said, has he tried again, Sarah?
He has not responded back yet,
Hmm.
but he could be trying to get in. Or he could have moved on.
Hopefully he
to this
doesn't have the
day.
old Zoom link. I wonder if that's why we didn't see him.
Let's see. I'll try to resend him the invite too.
Okay.
On his original one, he put a question mark. Like his response. It's gonna send it to all you again. I apologize, but just to send it back to him in case he is looking for it.
Oh, that's good. Bump it up.
And then if anybody else is sitting in their office and says, "Oh, I forgot about that," they can join too.
Hey,
Hello.
we have a
Oh.
quorum. It's official.
Perfect.
She's here. You can see her.
And hopefully Bob will still pipe
counts.
in.
It counts.
So do
Okay,
we
we
wanna
need
do
somebody
call to
to
order?
call to order. Is that the chair that
She's
does
the
it?
chair.
Call us to order,
Call
Sarah.
to order.
Are you
So
recording?
we're gonna call to order with a quorum in the room. And our first item on the agenda was the update on the recording secretary. We do
So the
not have a
update is
recording
we do not have
secretary.
one. We don't have money for one. We don't foresee having money for one. And we're making it work in the meantime.
So I just have a question then. Will the city manager submit a budget request in as part of his?
I'm not sure. I don't know.
So Sarah, my recommendation is to you as the chair to find out if the city manager plans on submitting as part of his budget
Funding for a.
funding for the health equity committee.
I'm taking notes. I'm being the recording secretary too. Hold on.
Yeah. Make sure you put that in the minutes. Does there need to be a motion or anything? No, right? No.
No,
Nothing
I think, that-
decided
right, I mean, this
Okay.
is just a request first,
for request for information.
right?
Okay.
request for Information first.
Gotcha. All right, moving right along. When the chair's ready.
Sorry.
All right.
Oh,
Rush
I-
the chair.
Into budget.
Yeah, I think
Right.
it's agenda.
Our second item on the list was the ethics requirement. There are still some people on the committee that have not completed the online vector solutions ethics requirement. It is about a 45-minute to an hour training, and then there are questions at the end.
So will you email folks directly if they're still delinquent?
Yes, do we have a revised list? Because people may have updated since the last list.
We'd have to get that from Jackie.
Okay.
Is there a time frame? If somebody has to
I've
complete?
done it before, like when we were doing it, I don't know if
Yeah.
do we need to update it?
No, there are some people who are new to the committee or new to it that have never gone through it. So the question is there a time frame? Like that you
Like,
have.
did they have to have it done by April or something?
Oh.
A due date for doneness. Can you
Okay.
look into a due date for doneness too? If we're
Yeah.
like, if the folks who have not done it are non-compliant and there may be any repercussions or something.
I would just set a due date.
Sure, or you can set a due date, Bridget said. So if there's not some existing rule about that, then go ahead and set one as chair.
Okay. Or set a date.
Jack, you should be able to tell the people who have, give the names of the people who haven't done it.
Our naughty
Okay.
list, I called it. All right, what's next?
So we have the review updates regarding the demographic perspective survey at our, not our February meeting, but our January meeting. We discussed that Kate was going to find out from Gomes what the original purpose of the demographic perspective survey was and if they still meet our needs.
Yeah, so she basically, in a nutshell, explained it to me like our department didn't have the capacity to run something like this. And as it was growing and evolving, it looked more and more like that's what was going to happen. So the idea was proposed to outsource that work. But now as things have evolved and we have more players at the table, and we've identified, United Way, ECHC, and this new link that I sent out to the folks for Health Equity Solutions. A lot of that work already exists, and Health Equity Solutions actually already worked with Hartford Healthcare too. So there's a lot of this work's already being done, and it didn't make sense to pay for that work to be done, and at least until we had a better idea of where we were going with all of this and what we might need from them. So they're available should we identify a need from them. But right now, we're moving forward as a committee without their input because other means exist for accessing that information.
Any comments,
it.
questions, concerns? No? Okay. So our next
And
agenda.
my
item is-
department paid for that, by the way.
Okay.
Just let the record show.
Thank you, Kate.
So where can we access that information?
Well, we were informed. We had nothing to do with it.
All right. So our next item was to define our scope and identify next level data. So the scope of the committee and what data points we are looking for.
Woof.
Can you turn that volume up? I can't hear it very well.
Yeah, I
Not in
think I
the
can.
hearing aid, but-
No, that's bright there. We can,
Okay, I'll move closer.
yeah, come closer. We're just scrunching up so everybody can hear better. Getting cozy.
And Michelle, did you have a question?
Oh.
Yes. go ahead.
Tables have turned now. She was off the hook for a little bit.
I'm representing Joe Zuzel today for Hartford Healthcare. So I'm the community health nurse with him. I just wanted to clarify the last thing that you guys said that about the demographic perspectives. You're moving forward without them and just going to be using the current strategies that are already around. Is that the idea, or are you?
right. Yep.
Okay. I just wanted to make sure
You got it.
Okay, perfect. Thank you.
Mhm.
So we're defining our scope and identifying next level data.
The scope is huge in the resolution. Should we break down the resolution into different similar parts, subsections? Because there's an HR section, there's a data section, there's an implementation section. Should we split these 13 subsections of this resolution into subsections? So they're manageable? That's
This is
just,
Patrick. I think there's going to be certain folks on this committee that'll feel more comfortable working on certain sections too. So that would allow us to pick where we feel them.
right, like HR would be on the HR stuff. Maybe you would be on the data side. Yeah, so what do you think, Chair? Do you have those 13 in front of you?
I
We
can pull them.
Go through and sort them? I have them if we need them. It's gonna shrink you guys down a level.
Do you want, instead of trying to do it on the fly, do you want to maybe send it out?
Sure, and see what people would want to,
And then prioritize based on that, and then where you're feeling most connected as far as the work to be done?
I love that. Did you hear what Patrick said? He
I did.
suggested
We're going to
sending
send
out
it out.
all 13. So why don't we send out, Sarah, you want to send out all 13 and then have people pick their numbers that they,
Prioritize and then.
Yeah.
Feel most comfortable working.
Right. Well, who's gonna, so,
we could do a
Should there-
survey?
well, no, I was looking like grouping,
Right.
who can start the grouping first to do the subsection?
Yeah, I mean, asserting racism as a public health crisis, that part's done. So we can check one right off our list because we did that. But developing strategies that work to dismantle systemic racism, that's gonna be our overall goal for all the subsections. So number 2 is like our umbrella. Number 3 is all Patrick. It says in partnership with Uncas Health District.
I guess I'll check that. out, 'cause my-
Yeah, I think 3 is yours. Develop
Developing
a Norwich Health
health
Equity
equity
Plan that
plan.
outlines detailed objectives and measurable goals in which the city will focus on root causes of the inequities that cause disparities in health outcomes for our residents. So developing a Norwich Health Equity Plan, that should be one subgroup.
Yeah.
And I think number 4 falls under that too. Engage historically marginalized communities in identifying problems and solutions. So we're obviously gonna need to engage with the marginalized communities to develop the Norwich Health Equity Plan. So 3 and 4, I feel like are, I'm just taking the lead here and grouping away, but anybody chime in?
I mean, obviously you need the data to show which communities are marginalized. and
Yes.
the Leadership of those communities, so you can get some buy-in.
It's a natural number 4. It's more like a 3A than it is a 4.
Okay, but right now it's listed, go ahead.
Yep, so number 1 is check. Number 2 is overall umbrella. 3 and 4 are together in a group. Ensuring complete and regular availability of specific race and ethnicity data. I think that also falls into 3 and 4, having that data to identify the marginalized communities. Yeah, I think that has to be Uncas Health too.
Well, thanks.
Well, can I not put it under a category yet? and-
Sure.
And say data collection?
Yeah,
Because there
data
could be-
collection,
Because
sure.
that could be a whole section.
That's
by
true.
itself.
It could feed into the other side.
Right, it's gonna feed into something.
Precursor to the other
But I
groups.
think
Yep,
we had talked about, I mean, first we were gonna use the data from the consultant, which
Right,
doesn't
that's right.
exist.
right.
And then we were talking about using the data from the community health needs assessment from Hartford Healthcare,
Mhm.
which I think, Michelle, can be broken down by Norwich specifically. Rather than just the Hartford Healthcare or the Bacchus region, I think you can break it down to some extent by,
Yeah, I believe some of it already is broken down by area, but I'd have to look to be 100% sure.
Yeah, you listed three.
Want me to put the link in the chat? Or
yeah,
the-
because I think
Yeah,
rather than
Eastern
recreate
Healthcare,
data, I
Eastern
think the
Healthcare
data already exists. We just need to pull it out.
HC.
Yep.
See,
And everybody that,
United Way in
Yeah.
Hartford Healthcare.
And obviously
And others,
Generations
yeah.
has data sets that would be helpful and UCFS has data sets that would be helpful. I mean, I
and
think-
all of those folks sit on the United Way ECHC too. So we're all in the same.
Missy, were you gonna
circles.
say something?
Yeah, I was just waiting for folks to be done. So when we were talking about data, I think I heard you all say the consultant does not have data for us. Is that the issue? And then when I checked out Health Equity Solutions, they had data. It's called a community conversation every year where they get data, but it's across Connecticut. So it doesn't specify by city. So we could use it as a benchmark you know, for Connecticut, like how does Norwich stand to the state versus in the city of Norwich, whatever data we come up with. But that would require looking at data the exact same way to compare apples to apples. And they asked questions about access to care and things like that. Although they didn't drill down. So people answered questions, I guess in focus groups or a survey of some kind that had, like, what do you consider the priorities in terms of health equity? And they might have answered access to health as the top priority. And then down below, they got a little more specific in terms of types of care and medications and things like that. But then what? So I would say once we get all the data, however we're getting it, whether it's Hartford Healthcare's needs assessment or look, you know, comparing to health equity, et cetera, and we have the assignments from the city council, then we basically just need to start, you know, chewing it apart about interventions or not.
That's a perfect segue to number 6. That is our number 6, exactly.
Interventions.
It's conducting ongoing and enhanced analysis using available data, and then identifying the factors that are contributing to the impact of racism on access to resources. So that would be like data, group 1 would be the aggregating, and group 2 would be analyzing.
In determining what do we do next?
Yeah,
Because you can analyze data all day long. This group
That's
could
right.
just look at data forever and ever and ever.
and that's what number 8 is. So you guys are right on track. I love that you're not even looking at this and it's coming out organically. Number 7 is focusing on access to prevention and treatment that's culturally and linguistically competent. So the actual rollout of direct service programs would be another subgroup of this. And that's number 8, is developing direct service programs. So 7 and 8 would be lumped together.
And what's your title?
7 and 8, direct service.
Okay.
And then this is where
How does human resources fit in this?
you're coming.
Yeah.
Look
Well,
at
just-
that. That was amazing. Good timing. You're number 9.
Okay, and how does this fit into?
So
That's
the
really-
city manager and human resource director commit to conducting all human resources vendor selection, which
That's
HR doesn't
purchase-
do.
Right. That's
Um,
purchasing and
yeah.
finance.
I mean, I pick my own vendors for my own department, but anyway, moving on, and grant management activities, they don't do grant management, but it's fine. City manager, it's under city manager too, with a racial equity lens, including reviewing all internal policies and practices such as examinations, hiring, promotions, leadership appointments, and funding. Promoting racially equitable economic and workforce development practices. So those are 9 and 10. So basically reviewing your existing policies, find the holes in them and fix them. That's 9 and 10. And then number 11 really ties back into our number 2, which was our umbrella. So I'd say 2 and 11 go together.
Which
It's
is-
encouraging community partners and stakeholders in the education, employment, housing, criminal justice, and safety arenas to recognize racism as a public health crisis.
Okay.
So encouraging awareness, basically. Again, that lies with number 2 and acknowledging that it's a crisis. And then expanding upon that. So that's like the outreach wing of it almost, rather than the direct service wing. And then 12 is identifying clear goals and objectives. Including specific benchmarks. And 13 is legislative advocacy. Which we're already doing, haha. Right? You were- She was just, but you know, that kind of counts. You were going there for equity too, right, Melissa?
Yeah, and HES is doing a lot of advocacy on the state level. They have several bills in for various items. So that might be something that we do
So there's a
As-
legislative subcommittee in the works here.
Yeah, as a, well, it's, someone should probably gather the info on those and disseminate it so that we all know.
Yeah, the
Um,
legislative subcommittee chair.
it shows you what areas of focus they have.
So. So if I follow the notes right, I think I came up with 6 areas.
Great.
1, 2, 3, 4, 5, 6, 12, and 13 being your specific areas themselves.
Mhm.
So the health equity plan, the data collection, the direct service, human resources, and that may be a different name, but right now,
Mm-hmm.
then identifying the goals and objectives, and then legislative advocacy, pardon me.
Mhm.
6 areas?
Yeah, yeah, so there's the
Julie,
like
can you say the
overall
6 again?
umbrella. So the first section is the health equity plan, like development, which is numbers 3 and 4. Then there's the data side. And that's kind of split into aggregation and analysis. And then there's the direct service side. Oh, by the way, data is number 5 and 6. Sorry if you're keeping track on numbers. Direct service, numbers 7 and 8. So that's like implementing things in a way that overcome systemic barriers. And then the next section is like internal city processes. And so that's specific to how we operate internally. And that's numbers 9 and 10. And number 11 is tied up to number 2. That's kind of the umbrella scope mission, if you will. And then number 12 is bringing it all together to have specific objectives and deliverables identified, which I think is pretty similar to the planning portion of 3 and 4. 3, 4, and 12 could probably be grouped together. But I think they're contingent upon the data, the direct service, and the internal identification of gaps.
This all has to be done to do 12
Yeah,
and even 13.
yeah.
Once all that's done, it's really
Then once we have a plan, we can push for legislators to adopt it.
12 and 13. Yes.
Mhm.
Okay.
Is that clear? Our recording secretary approve?
Yes. So I did write down health equity plan, data aggregation and analysis, direct services, internal city processes, umbrella scope of mission and vision, and legislative advocacy.
Hey, make sure this.
Sure. So you don't mind my chicken scratch.
Oh, I love it.
What was section 1 and 2?
I'm sorry?
What was section 1 and 2?
So for one, we had health equity.
One is
plan.
what we're doing. One is the
One is-
formation
yeah.
of the committee. And 2.
Yeah, one was acknowledging that there's a public health crisis. So
Which is-
one was the crisis, and 2
The umbrella.
was developing strategies that work.
So we put 2 and 11 together under the scope or umbrella, whatever we want to call that. Okay?
Our
Thank
core.
you.
Well, look at that. We have 15 minutes left. What's next?
So we wrote down that we have the 6 areas divided into subcommittees. We're gonna send that out to the group so people can sign up for the subcommittee of the work.
Okay.
Kate, if I could have a
Yes.
virtual, I have a paper copy of those numbers, but if I have a virtual one, I can cut and paste it into an Excel sheet for people. to
Oh,
sign
I
up
only
for.
have, I will get you one.
Okay, if not, I'll
I
take
only
it.
have my one that
Um,
has chicken scratch on it.
So it sounds like, and I just want to confirm that we landed on the 6 committees, health equity plan, 3 and 4, data aggregation and analysis, 5 and 6, direct services, 7 and 8, internal city processes or internal operations, 9 and 10, umbrella scope, mission and vision, 2 and 11, and legislative advocacy, 13 and 14.
Great.
Well, no, separate out 12, because
Okay.
that's what our, after we do all of this, what are gonna be our goals and objectives after we do all the data and analysis and all that collection we have to develop. And then 13 will be the legislative advocacy. Okay,
Great.
So if there are no other questions on that, I will create a form where people can sign up under their area of interest and expertise. Any other questions on that one before we move to your items?
Oh, we already talked about your items when we thought we
Yes.
didn't have a forum. So you
So
wanna just
under,
go over it real quick for the
yep.
folks that are here.
Absolutely. So under your items, we have the Health Equity Solutions website that Mrs. Uzel provided to us and was referred to in the meeting. If everyone could take a look at that, to see if that would be a resource that would be useful. I know it was mentioned briefly that that might be something that we can use to look at some data from a state level perspective. Maybe not necessarily from a Norwich perspective. Any questions on that website? I know I sent it in
No.
advance as well. And then the second item on that list was that our Health Equity Committee semi-annual report is due on 3/26. We reviewed some sample semi-annual reports that have been submitted by other committees. And based on the work we've completed to date, we did find an example that would suit our needs, that would just speak of the members, the mission of the group, and our basically these subcommittees of our plans for the future work.
Great.
If I can just add, Health Equity Solutions also has a whole path to follow. So I don't know so much that we need to recreate the wheel on some of these things.
Yep. That's why I sent
so
it
if-
out.
Yeah, if you guys go to that website, it looks like this says Path to Equity is one of the documents on their website, and it breaks out like data measures to use for number 12 on our list and things. So I think it would help each of our committees come up with some specifics.
That's, yeah. That's why-
agree, agree. We're agreeing with you.
And I want the record to show Joe's not the one that sent it out, Sarah. I sent it to Joe first.
Okay, because he sent it to me. That's why I put it on the agenda. And could you say the name of that packet one more time? I just want to make sure that I write down the right thing. The whole path, what was it called, Melissa?
Equity Solutions.
They call it Connecticut's Path to Equity,
Path to equity.
a guide to state policy for health equity.
Great. Somebody has to motion to end the meeting,
Well,
right?
So we
you
had
said
one
set
more
agenda for the
item.
next meeting?
Oh,
Yep, we had one more item that, if
Okay.
there was any agenda items other than our standing items we had. One of the items we will want to do is revisit who signed up for the subcommittees. So if the group's in favor, viewing subcommittee would be one of the items next month.
mhm.
Well, we also should review who has signed up for, who was appointed to the Equity Committee. And who is not able to attend or no longer interested or involved.
So
Sep-
evaluate membership.
Because I think that should go in front of, since this report, that report's going to the city council. That report should go to the city council, should be included, Sarah,
Mhm.
okay, in case, because they took the action to create the committee. Okay, so it may have to go back to them. And then there's, because according to city committee, is if you miss more than 3 consecutive meetings. So I think and I know we had already identified this is not a good time for Erica Brennan. So we may have to ask for a resignation or a reconsideration by the city council.
That's true, yeah.
Okay.
And we have a list of the original appointed members, correct?
Yeah.
I believe that's who I put in the invite each time. So
That's right.
in prep for next meeting, would you like me to reach out to them, the people who had not been attending, to see if they are, or?
Yes, right. And if it says they could have a designee, who their designee is.
And definitely, I agree. Put it in the report. If you reach out to them and you still don't hear anything, then you can report back to city council, X, Y, and Z stopped showing up. I tried one last time to get their engagement and failed, so that it's documented accurately. I'm trying to get you guys an extra 10 minutes to your day here.
I know, but I want to make sure we complete our work
I
before.
know, I missed the last step of the agenda,
This is
sorry.
Patrick. My only comment, before we start establishing subcommittees, obviously we have to get control of this committee. So I don't want to ask people to be a part of a second meeting or another meeting. So I would say, just to be clear, this isn't going to be a subcommittee that meets separately of this particular meeting. That it just might be somebody who becomes sort of that subject matter expert on that particular agenda item or that particular agenda item.
Yeah, little category.
The categories.
subset,
Yeah.
Yeah, resolution.
But I don't want
subset.
to scare people away with them thinking, all right, great, now I'm signing up for
Even more
meetings.
meetings.
Yeah.
I think that's a
Well,
really.
maybe instead of calling it subcommittees, we could just say like
Focus.
areas of interest or
Correct.
areas of focus
Yeah.
for the
That's
members.
That's fine.
Because if I wasn't at this meeting and I heard subcommittees, I think I'd panic.
Yeah, that's fair. But you're chairing a subcommittee already.
I mean, you think of the number of,
You
the
came to
Eastern
the
Connecticut
meeting.
Health Collaborative has a regular
Right.
meeting, plus they have an
Oh, I
executive
know.
committee that we're on, plus we have subcommittees.
And you guys can't come to
So-
our task force meetings already because you guys are all on the ECHC.
Right.
meeting.
So that does a lot of
Mhm.
the similar work. So I feel like we're already kind of mirroring that work on more of a regional level.
So do they break it down all the way down to the individual cities and towns?
It's possible to mine into it. Yeah,
Okay, so
Yeah.
we gotta extrapolate.
yeah.
Yeah, and that's what I was
Mhm.
trying to get at with Michelle, is to see where the data we have, how it can be broken out by city.
Well, it sounds like you guys will be heading up
You
that.
already have work. You've done work around that. Some of the internal, I'm sure we can pull it from purchasing and then whatever. From the city manager.
Yeah.
Pull that together.
So
Yeah.
Okay.
so I'm willing to make a motion to adjourn.
Okay, go ahead.
Motion to adjourn.
I'll second.
So, I was gonna say so moved, don't you?
No, she a chair
So
now.
moved.
All those in favor, all those in favor first.
Bye.
Aye.
Thank you.
Any- Okay.
Okay, we're officially
Thank you.
dismissed. Thank you,
Thank you.
Sarah.